If you're having trouble with your bladder, it may be your SI joint. In this video, I'll be answering questions like, what is the SI joint and what role does it play in pelvic stability? How can an SI joint issue affect bladder function? What are the signs that bladder problems are linked to the SI joint? And can correcting an SI joint issue improve bladder health? And finally, what treatments or exercises help with SI joint related bladder dysfunction? So let's begin with the first one. What's the SI joint and what role does it play in pelvic stability? So I have my pelvis model. SI joint is sacroiliac joint. This is your sacrum, this is your ilium, these are your SI joints. So that's back here, right there. So your pelvis is consisted of ilium and sacrum. In the front, they come together to form the pubic area. So when you have instability in your SI joint, your pelvis itself is unstable. An unstable pelvis means this, which is the foundation to your trunk, is going to be compromised. So the muscles inside of your pelvis work with the muscles outside of your pelvis and anything else that's connected to it. That's your spine in this above section and your lower extremities that go into the socket forming the hip joints. So when we have instability in the pelvis, we are going to have to make up somehow to make this stable. The muscles inside work with the muscles on the outside, like I just said. And if that instability is coming from outside, the only thing we can rely on to provide more stability is going to be the inside. It is the issues on the inside that cause the so-called weakness, weak pelvic floor, or we can have tight pelvic floor. So these are variations, modifications, and adjustments those muscles had to do as a response to what's happening on the outside. How can SI joint issue affect bladder function? Well, your bladder is sitting in the front. So if you look at it this way, you've got your bladder in the front. When this is unstable, you not only have biomechanical reasons to compress the bladder, you can also have issues related to the nerves that control the bladder. Those nerves come from back here. So instability in this area can cause issues with the nerves that exit your spine to go to the bladder. So now you've got neurological input to the bladder that are interfering with its function. What are the signs that the bladder problems are linked to the SI joint? Well, you can have pain in the lower back or pelvis near the SI joint. You can have difficulty starting or stopping urination. You can have incomplete bladder emptying, increased urinary frequency or urgency without any infection, pain or discomfort during urination, increased bladder symptoms with too much sitting or standing. Bladder symptoms improve or get worse with SI joint manipulation or exercise. So how many of those do you have? Can correcting an SI joint issue improve bladder health? It can. But if that's been going on for a while, don't think that the issue stays with the SI joint only. While this poor SI joint was under stress and your whole body's mechanics and the whole muscles and body parts engagement changed to accommodate for that lag, the SI joint is where it showed up. But you got to look at the whole area, because if I'm trying to address this without addressing, let's say, the spine above or the lower extremities connected, without addressing the methodology, the way you walked around and sit or did all the activities of your daily living without even realizing the modifications that had to take place, now the presence of those become the reason why the full recovery changes. The last question, what treatments or exercises help with SI joint related bladder dysfunction? Well, I will show you 3 exercises, but please understand, we cannot just address the SI joint and think that that's going to solve the problem. Everything when it comes to gaining stability and functionality, we all went from helpless infants to running toddlers, going through whole body engagement with a spotlight on a specific region that was happening. So for example, in an exercise I'm going to show you, this is an exercise where my whole body is going to perform their part like background musicians, while the spotlight is put on my front of my trunk being challenged. So in this exercise, which you did at age 3 months, you are laying down on your back, keeping your spine close to the ground. So it's not lifted, it's nice and flat. It is the muscles in the front of my trunk that is in charge of grabbing my pelvis and bringing it into a neutral position. It is not my thighs shoving themselves into the socket to try to bring my pelvis to a neutral position. It is not me sucking my tummy in, which pulls this up. It is not my butt clenching to shove the pelvis up. It is the muscles that are attached to the front of my pelvis and going around the edge of my ilium that will pull the pelvis into this position. It is these muscles that are continuing to do their work as I can stay in this position and bring one leg up and bring the other leg up. It is the trunk muscles that are in charge of my pelvis as my legs can do their separate legs work. This is my whole body being engaged, doing their part as the spotlight is on my front of my trunk to do its job. The next exercise that I absolutely love for the SI joint is putting myself with gravity as a challenge. I'm going to be on all 4 and hip over knee, shoulder over wrist. Maybe my wrist can go a little bit in front of my shoulder. It's not a straight shot. And my job is, my task is to breathe biologically, not let my back arch or curve, and keep it in a neutral position, and breathing into my trunk to the pelvis, and really that pressure from the inside against the front of my spine and the inside of my SI joint right here, that will allow this ligament, my sacroiliac joint, to stay nice and in place. So my sacrum is connected to my ilium with that pressure reinforcement from the front, and my job is to hold this and practice stability that way. And finally, I love this exercise, which is a side posture of my body going. So I'm going to start with the 3 months, have my arm out, turn towards the camera in this case, and then this is all lifted, and then I'm tilting my trunk back and forth. What I'm trying to do is not to keep my legs quiet, so it's not my legs saying let's turn and then I turn my body. Instead, I am stabilizing my lower extremities and upper extremities connected to my body as my trunk muscles will rotate me in and out like an open and closed book. All these 3 exercises that I showed are examples of stabilizing the pelvis in different planes and allowing different parts of the body do the job of stabilization doing their part as I go through those separate movements. These were all examples of what developmental kinesiology movements are and the kind of exercises that we all are very familiar with and have done for at least the first 4 or 5 years of our lives. Please make sure you like and comment, and until next time, have a great day.